Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
What should coders be doing at this point? Coders need to remain educated regarding ICD-9. Being proficient with the ICD-9 system will definitely make the transition to ICD-10 easier. Though it's too early to actually learn how to assign ICD-10 codes, it's not too soon to become familiar with the organization and structure of the ICD-10 code set and how it compares to ICD-9, why we should use ICD-10, new features of the system, and how the codes look. These topics, as well as training strategies, will be discussed today during this introduction to ICD-10. Next slide. First, we'll take a brief look at the background of ICD-9. ICD-9, International Classification of Diseases, 9th revision, is a classification system of diagnoses and procedures that is used for reimbursement and to evaluate patient care and ultimately improve patient outcomes. This system was developed by the World Health Organization, we know as WHO, for worldwide use. The United States developed the clinical modification, or CM, for morbidity purposes, which is the incidence of disease. The terms morbidity, disease, disorder, and illness are often used interchangeably. And this system was implemented by the United States in 1979. Since 1999, ICD-10 has been used to code and classify mortality data from death certificates. Currently, ICD-10-CM is the official system used in the United States to classify and assign codes to health conditions and related information. ICD-10-CM will be the replacement for ICD-9-CM Volumes 1, the tabular list, and Volume 2, the alphabetic index. Next slide. Let's take a look now at the history of ICD-10. ICD-10 was adopted by the World Health Assembly in 1990. On January 16, 2009, the final rule was published by the Centers for Medicare and Medicaid Services, CMS, with a Health and Human Services, HHS, compliance date of October 1, 2013. At that time, CMS said that this compliance date was firm and would not change. However, on February 16, 2012, Kathleen Sebelius, the HHS Secretary, announced an intent to delay the ICD-10 compliance date. This delay was in response to a request from a significant number of healthcare providers, including the American Medical Association, who were concerned about meeting the transition requirements on time. However, 79% of commenters on a 3M survey regarding the ICD-10 delay stated they were not in favor of the delay and that the delay would result in even higher expenses for healthcare providers. It's estimated that a one-year delay will add 10 to 30%, which could be $1 billion to $6.4 billion to the total cost that has already been spent on the transition. On April 17, 2012, HHS released the pre-publication proposed rule to delay ICD-10 implementation until October 1, 2014, with a 30-day comment period that ended on May the 17th. On August 24, 2012, HHS issued a final rule making official the one-year delay for mandatory adoption of ICD-10. In order to reduce the perceived regulatory burden, the delay was upheld. We must be ready by then. If we're not ready, there will be penalties. Claims won't be processed and therefore not paid. There's been talk about fines, but there's no official word, and those discussions are now ongoing.
Supercoder is the fastest-growing online reference tool with more than 25,000 subscribers. Call 866-228 888-928-9252 to get a free product demo, or sign up at supercoder.com for a 7-day free trial.